Thank you very much. Good morning, everyone. We're joined virtually by Ministers Freeland, Qualtrough, Duclos, as well as Dr. Tam and Dr. New. We're here today to talk about what we're doing to support workers and businesses and keep people safe. Before I get started, I just spoke with the two new leaders of Chile and Germany, both progressive leaders, where we talked about climate change, growing the middle class, trade and youth, protecting democracy, and of course, how we're all going to work together to get through this COVID pandemic. À quelques jours de Noël, je sais que beaucoup sont inquiets. Comme depuis le début de la pandémie, on sera là pour vous. Aujourd'hui, on adapte nos mesures de soutien pour s'assurer que personne soit laissé pour compte. We made a promise at the beginning of the pandemic to have everyone's backs, as long as it took, as much as it took. That was the right thing, not just to help minimize the impact of the health crisis, but also to ensure that our economy could handle the shocks that this crisis is facing. And that's, unfortunately, what we're going to be continuing to do right now. I say unfortunately because, of course, nobody wants to be in the middle of an Omicron wave right now, but we are. So we are announcing today that we're temporarily expanding eligibility for key programs. For the Canada Worker Lockdown Benefit and the Local Lockdown Program, you'll be able to apply if you're subject to capacity limiting restrictions. The Deputy Prime Minister will have the details, but here's the bottom line. We need to, all of us, do what it takes so Canadians are protected and to have what you need to weather the storm. We're going to be there for the hard-hit regions, for specific sectors like art and culture, hospitality, and tourism. We will be there to keep you and your family safe. We're going to continue to work closely with the provinces and territories, but we will be there with supports for the areas that need it. Notre priorité, c'est que les hôpitaux ne débordent pas. Avec plus de 80% des gens pleinement vaccinés, vous avez fait la bonne chose et vos efforts
So you have done the right thing, and your efforts are helping.
Allez-y.
Those of you who are not yet vaccinated, please be vaccinated. And also know that we have enough booster shots for all eligible Canadians. So please make your appointment when it is your turn. We know that these booster shots will help.
We have enough in the country for everyone who needs it. So please, go get those booster shots. They give you extra protection against Omicron and in keeping us all safe. Pediatric vaccines continue to roll out. Get our kids vaccinated as well. It's going to be really, really important that we do everything we can to get through this. We know that rapid tests are a part of the solution as well. We've delivered about 85 million rapid tests up until the month of December to provinces and territories. Just this month in December, we're delivering about 35 million rapid tests to provinces and territories, and we've got tens and tens of millions more rapid tests arriving in the coming weeks into the new year. So provinces and territories will have the supplies necessary to get them into people's hands. We need to follow public health guidelines to keep loved ones safe and to support our healthcare workers. I know people are tired. People don't want to be in this Omicron situation. I get it. None of us want to be here. We're tired of COVID. We want it to just go away, but we know it's not going to just go away unless we all do our part. Particularly when you think of how tired you are, how weary you are of having to deal with this COVID crisis that continues to go on and on and on. Know that there are people more tired than you. Know that our healthcare workers haven't had much of a break over the past 2 years, that they've been going flat out, keeping people safe, working in long-term care homes, working in hospitals and clinics, administering vaccines and boosters. Our frontline health workers have been extraordinary heroes. They have been there for us every step of the way, and now we need to be there for them. We need to prevent Omicron from overwhelming our healthcare systems. In order to do that, we have to keep contacts low. We have to make choices that are going to keep us and our families safe, because Omicron is out there. And the way we show our support for those people who've been keeping us safe is by making sure they don't get overloaded this winter. We know this variant is spreading very quickly around the world, around the country, and indeed around our own communities and offices. My office is not immune. We have 3 members of my staff and 3 members of my security detail who've tested positive. They're following all public health guidance. So am I, and so must we all. But it's a reminder that the virus is all around us. It's very much a threat. We have to keep our guard up. À Noël, je sais qu'il y a des gens qui vont pas pouvoir se rassembler comme ils l'auraient voulu.
Who will not be able to gather as they wish to.
Avec ma famille proche, mais il y aura
I also had plans to spend time with my close loved ones, but there will not be any parties or gatherings, and this is a reality we all are facing.
We know what works. Canadians have shown over the past 2 years that we're able to step up for each other, that we are there for each other. We know what to do. We know how to wear masks. We know how to keep our distances. We know how to reduce our contact numbers. And if we do that well over the next couple of weeks, we're going to see a better winter and especially a better spring than otherwise. I know nobody wants to be in this situation right now, but Canadians have shown that we're there for our neighbors. We're there for our most vulnerable. We're there for our frontline health workers. We have vaccines, we have PPE, we have rapid tests. We know what to do. We're going to do it, because that's who we are as Canadians. We stick up for each other. We make those tough choices to keep each other safe. And we know that as long and dark as winters can be, spring is coming, and spring will be better if we hunker down in the coming weeks. Merci beaucoup, mes chers
Thank
amis.
You very much,
Je passe maintenant la
parole à
la vice-première ministre
Freeland. To Deputy Prime Minister Freeland.
Okay, merci, Monsieur le Premier ministre.
Thank you, Prime Minister.
Bonjour tout le monde.
Good day, everyone.
Dans les derniers jours, nous avons constaté
In the past few days, we have observed an increase in cases of COVID-19. Certain regions of the country are reporting record numbers of cases. The Omicron variant of the virus is much more easily transmitted than the others. And we cannot be complacent. Since the beginning of the pandemic, we have endeavored to be flexible and to adapt to the changing nature of the pandemic. Within our programs, we are ensuring to plan for the necessary leeway so that we may react rapidly and effectively. Last week, we saw Bill C-2 adopted. This law made it possible to put in place targeted measures to support workers and companies if lockdowns became necessary to contain the spread of the virus. During the month of October, when we introduced these more targeted measures, we did not yet know the Omicron variant, but we made sure that we were ready.
Today, through regulatory authorities that were approved with the passage of Bill C-2, we are announcing our decision to temporarily expand the definition of a lockdown so that these wage and rent support programs can support workers and businesses that see capacity restricted by 50% or more. So, what exactly does this mean? It means that if you are an employer who has to reduce the capacity of your main business by 50% or more, you will be eligible for wage and rent subsidy support through the local lockdown program. And we are lowering the revenue decline threshold from 40% to 25%. Eligible employers will receive wage and rent subsidy support from between 25% to up to 75%, depending on how much revenue they have lost. Your organization only needs to demonstrate revenue loss during the current month compared with 2019. Employers will be able to apply for these expanded support programs after the end of each program period in exactly the same way that they received wage and rent subsidy support when those programs were launched last year. For workers, our decision means that if you are working in a region where the provincial or territorial government has introduced capacity restrictions of 50% or more, and if you have lost 50% or more of your income as a direct result of those restrictions, you can qualify for the Canada Worker Lockdown Benefit. This benefit will put $300 a week in your pocket to supplement your lost wages. This proposed expanded eligibility will be effective as of last Sunday, December 19th, 2021, and it will run through to February 12th, 2022. Many parts of the country have already introduced circuit breaker public health restrictions in order to curb the rise in cases of COVID. These expanded federal support measures will ensure that provinces and public health authorities across the country can continue to make the right, difficult decisions they need to make to save lives, confident in the knowledge that the federal government will be there to financially support workers and businesses as we finish this fight. Notre gouvernement sait que d'autres entreprises sont encore touchées par la pandémie. Depuis hier, les employeurs admissibles peuvent demander une aide financière par le biais du programme de relance pour le tourisme et l'accueil et du programme de relance pour les entreprises les plus durement touchées. Ces programmes offrent des subventions salariales
propose wage subsidies and rent assistance up to 75% and 50% respectively. In October, when we announced these programs, we estimated they would cost $7.4 billion. Last week, in the Economic and Fiscal Update, we set aside an amount of $4.5 billion in planning for the impact of the Omicron variant. The cost of expanding the support measures is estimated to be $4 billion and will be completely covered by the amount that we planned for in the update.
And finally, let me add that public companies receiving the wage subsidy through these support programs that increase their top executive compensation in 2022 compared to 2019 will have this wage subsidy support clawed back. These companies will also become ineligible if they pay dividends while receiving the wage subsidy. So, as Dr. Tam reminded us last week, all pandemics do end. The emergence and the swift rise of Omicron is not something that any of us welcome. It's coming at a hard time, at a time when many of us, particularly our remarkable healthcare workers, are really, really tired. But I know that we can and we must do what it takes to beat this virus, to finish the fight against COVID. Canadians are smart, we are resilient, we support each other, and we have the tools we need, both healthcare tools and financial support measures to win this fight against COVID. With today's expanded federal support programs, Canadians can follow new provincial health restrictions, knowing that the federal government is there, as we have been from the start, to support everyone. Thank you. And let me now pass the mic over to my colleague, Minister Carla Qualtrough. Carla, please.
Merci, thank you, bonjour, hello everyone.
Good day.
J'aimerais vous parler brièvement de la façon dont nous
briefly speak
soutenons
to
les
you
travailleurs
about
canadiens
how we are
face
supporting
à cette crise de santé
Canadian
publique
workers
qui
in the
évolue
face of
rapidement.
this rapidly
Nous
evolving
avons
pandemic.
constaté récemment une
Recently,
augmentation
we
du nombre de
noticed
personnes qui
an
ont reçu un
increase
résultat positif
in the number
au
of
test de
people receiving a
dépistage de la
positive
COVID-19 partout au
result
Canada.
here
Nous
in Canada for
constatons une fois de
COVID-19.
plus que des régions et des provinces imposent des
again,
restrictions de capacité
We
et,
are seeing provinces and
malheureusement, des
territories
fermetures complètes ou
having to
partielles.
impose
Ma propre province, la
partial
Colombie-Britannique, a
closures
annoncé des
and
mesures
restrictions.
pas
My
plus
own
tard
province
qu'hier.
of British Columbia made
If
such
we've learned
announcements
anything from
yesterday.
this pandemic, we've learned that COVID-19 is unpredictable and we don't always know what lies ahead. But unfortunately, we know that we could be in a situation again where there would be new regional public health measures to help stop the spread of COVID-19. So when we introduced Bill C2, which included the Canada Worker Lockdown Benefit, we made sure we built in flexibilities so that we could be agile and make adjustments to support Canadian workers in their time of need. As we've been monitoring the public health situation, we've seen the need to expand the eligibility of the benefits for Canadians whose jobs are impacted by partial lockdowns or reduced capacity orders. That's why today we're making the necessary and temporary adjustments to the benefit to expand the definition of a lockdown order to include workers facing work reductions as a result of capacity restrictions of 50% or higher. Eligible workers could receive $300 per week if they've lost work as a direct result of a public health lockdown order. This Canada Workers Lockdown Benefit is in addition to the Canada Recovery Sickness Benefit and the Canada Recovery Caregivers Benefit, both which remained available to Canadian workers. We understand that Canadians may be feeling discouraged by the recent rise in COVID cases and new public health measures, especially at this time of year. And while the situation is evolving rapidly across the country, please be assured we'll continue to support Canadian workers as we've done throughout the pandemic. I'll leave it there and I'll pass it on to my colleague, Minister Duclos.
Merci beaucoup, Carla, et
Thank you
bonjour à
very much,
tous et
Carla,
à
and
toutes.
good day,
C'est
everyone.
avec grand plaisir que je me joins à
I'm
vous de
very
façon
pleased to be
virtuelle
joining you
aujourd'hui.
virtually
Thank
today.
you for being here. Today, I want to provide you with a brief, quick update on the current COVID-19 situation. Even though we had all hoped that this holiday season would look very different than what it does, there are still many reasons to be optimistic. Vaccines for adults and children are widely available, as well as booster doses, thanks to the largest vaccination program in Canadian history. As we end this year, over 80% of eligible Canadians are indeed fully vaccinated. Du 19 novembre, date à laquelle Santé Canada
Between November 19th, which was the date Health Canada and authorized Pfizer's vaccine for children, and December 11th, 32% of children in Canada aged 5 to 11 have received one dose. This happened in just 3 weeks. These are remarkable accomplishments. We would be in a far more challenging situation if we did not have such high vaccination rates in Canada. So first of all, I would like to thank everyone who has already been vaccinated this year. Now that booster shots are available, I encourage everyone to make your third appointment if it has not been done already.
And then getting a booster, whether Pfizer or Moderna, will help provide protection against infection and illness. On this particular point, let me be very, very clear. As soon as you're eligible, whether it is Pfizer or Moderna, you should take the first booster dose available to you. If you have yet to be vaccinated, it is not too late. Every additional vaccinated person helps support our defense against COVID-19, as well as protecting personal health and safety. The Government of Canada continues to work closely with provinces and territories and public health partners to accelerate the rollout of booster vaccination campaigns. Close to 5 million Canadians have already received their booster doses. Nous avons également en stock suffisamment de vaccins à ARN messager pour administrer plus de 22 millions
to
de
administer more
doses de
than
rappel
20 million
partout
booster
au pays.
doses across the
Des
country.
millions d'autres doses seront livrées au
Millions
cours
of
des
additional
prochaines semaines
doses
et
will
des prochains
arrive
mois.
in the coming weeks
Les
and
stocks
months.
de doses de rappel sont
The
suffisants
supply of
pour
boosters
offrir une dose
is
de rappel à
sufficient
toutes
to
les
offer
personnes admissibles au pays,
everyone to have
que ce
one who
soit
is
des vaccins
eligible in
Pfizer
Canada,
ou
whether
Moderna,
it be
qui sont tous les
Pfizer
deux
or
sûrs et
Moderna
efficaces.
boosters. Both are
Permettez-moi
safe
d'insister,
and
dès que
effective.
vous êtes admissible,
As
qu'il
soon
s'agisse de
as you
Pfizer
are
ou de
eligible,
Moderna,
I
vous
encourage
devriez prendre la
everyone
première
to
dose de
make
rappel disponible.
an appointment for
The
the
Government of
first
Canada also
available
continues to
booster.
work closely with provinces and territories to increase access to rapid testing supplies across Canada. As you may be aware, each province and territory determines its desired approach for testing, screening, and surveillance, as they are responsible for the delivery and administration of healthcare services. We are making sure that our distribution strategy ensures equitable access to rapid tests for Canadians all across the country. As a screening tool, rapid testing provides another layer of protection against COVID-19, along with many other public health measures, such as mask wearing, hand hygiene, physical distancing, proper ventilation, and obviously vaccination. Rapid tests are able to identify individuals who have a high viral load, despite the test's lower sensitivity compared to a molecular PCR test. Des résultats rapides signifient une intervention rapide. Mais il est crucial de se rappeler que ces tests ne sont pas parfaits. Si vous obtenez un résultat négatif, continuez d'être prudent en présence d'autres personnes, puisque vous pourriez être au premier stade de l'infection et pourriez donc infecter aussi les autres. Si vous obtenez un résultat positif, il est crucial de vous isoler et de suivre les conseils de santé publique de votre localité. Sur la livraison des tests rapides, la majorité des 35 millions de tests rapides commandés par les provinces et les territoires pour le mois de décembre ont déjà été livrés. Les tests restants seront reçus avant la fin du mois et des dizaines de millions de tests additionnels arriveront en janvier et en février. We're also continuing to expand the distribution of rapid tests across Canada. In time for the holidays, we're further working with the Canadian Red Cross who will partner with community organizations, including food banks, to distribute rapid tests to Canadians who use their services. In conclusion, I will urge you to continue to be prudent and responsible this holiday season. Please take responsibility for your health and the health of others by following the advice of local public health officials. Restez en sécurité et restez prudent. Faites-vous vacciner si vous ne l'avez pas encore déjà fait. Et si vous y avez droit, recevez votre dose de rappel. C'est évident, et on l'a vécu l'an dernier, les fêtes de fin d'année sont un moment propice à la transmission du virus. Ce sont les gestes que nous poserons individuellement dans les prochains jours qui détermineront
will be determined
notre sort
by
dans les
the
prochaines
decisions
semaines.
that we make
Et je cède
and our
maintenant la
actions
parole
during
à
the
la
holidays. I will now
Tam et
turn the
au
microphone
Dr.
over to Dr. Tam and Dr. New.
Bonjour à toutes et à
Good
tous.
day, everyone.
So in less than a week, we've seen a rapid acceleration of epidemic activity in locations across Canada. While Delta is still spreading in many areas, Omicron is increasingly responsible for rapid rise in case counts. With over 2,360 confirmed Omicron cases to date, this new variant is now predominating in several locations across Canada. Compared to a national average of over 5,000 new cases being reported daily by the end of last week, there were over 11,300 new cases yesterday alone. Modeling shows that by the beginning of January, we could have a very high number of cases, which underscore the need to act urgently now to reduce the acceleration. At the moment, severe illness trends are increasing in the most heavily impacted provinces, which has begun to shift the national trend. Over the past week, on average, over 1,500 people with COVID-19 were being treated in our hospitals each day, with close to 460 in intensive care units, and 17 deaths were reported daily. Although the current trends may be a lagging impact of increased Delta activity in the preceding weeks, rapid acceleration of Omicron activity is expected to further impact these trends as well, even if Omicron turns out to be less severe. Because we're especially worried about the potential impact of a sudden and strong surge on the healthcare system, we're urging all Canadians to do what they can to help mitigate this. Although the situation is not the same everywhere, this variant spreads extremely quickly, and the situation can rapidly get out of hand anywhere. So while public health authorities are closely monitoring the evolving situation, we can all help by reducing our contacts as much as possible. Practically speaking, this means keeping gathering sizes as small as possible, such as limiting to just family and close friends who you know well. Everyone who's eligible should get fully vaccinated and receive a booster dose as soon as they are able. And everyone should use layers of protection, since no measure is perfect or applicable for all people. In particular, we can reduce the risks of exposure and spreading the virus by improving and maintaining good ventilation and wearing a good quality and snug-fitting face mask, while remaining flexible if plans need to be adjusted at the last minute. Currently, we'll still need many more people to increase their protection with COVID-19 vaccines. Over 7 million eligible Canadians need a first or second dose of the primary series, and many more are eligible to get a booster dose to help restore protection that may have waned since their second dose. Booster doses of either Pfizer or Moderna mRNA vaccines should be prioritized for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. Although we're all dealing with some disappointment and changed or disrupted plans, I hope we can all agree that we're doing what we need to do for all the right reasons. Beyond taking extra precautions to safeguard our health and the health of our family and friends, we're also adjusting to safer plans in order to safeguard our health system and get everyone through this difficult time that much faster. We've said this before, but I want to especially acknowledge our healthcare and public health workforce. They have been there for us and have made daily sacrifices that many of us can only begin to imagine. Now that they are facing what could be the largest and most sudden impact to date, at any time when they are arguably at their most exhausted, they need to know that we're all doing everything we can to minimize the threat before us all. These are not the holidays we wish for, but it doesn't mean that we're back where we started. We have more and better tools in our toolbox, including vaccines and booster doses, better knowledge of transmission and enhanced guidance on individual protections, as well as more testing options and improved clinical management and treatments. For the coming weeks, we have to work to these strengths and keep working together to clear this hurdle. Thank you. Merci, Megwitch.
Bonjour à toutes et à tous.
Good day,
En moins
everyone.
d'une semaine, nous avons assisté
In less
à
than a
une
week,
accélération
we've seen a
rapide de
rapid
l'activité
acceleration
épidémique dans
of
plusieurs
epidemic
régions du
activity
Canada.
in many
Alors
locations
que le
across
variant
Canada.
Delta se propage toujours dans de
While
nombreuses
Delta is
régions,
still
le
spreading in
variant
many areas,
Omicron est de plus en plus
Omicron is
responsable
increasingly
de
responsible
l'augmentation
for
rapide
rapidly
du nombre
rising
de cas,
case counts.
avec plus de
With over
2360 cas d'Omicron confirmés à ce
2,360
jour.
confirmed
Ce
Omicron
variant
cases
est
to
maintenant
date,
prédominant
this
dans
variant
plusieurs
is
régions
now
au pays.
predominating in
Alors que
several
la moyenne
locations across
nationale était
Canada,
de plus
compared to
de
a
5
national
000 nouveaux
average
cas
of
signalés
over
quotidiennement,
5,000
à la
new
fin de la
cases being
semaine
reported
dernière,
daily by
on
the end
comptait
of
plus de
last
11
week.
300
There
nouveaux
were
cas
over
pour la seule journée d'hier.
11,300 new
La
cases
modélisation
yesterday
montre qu'au
alone.
début de janvier, nous
Modeling
pourrions
shows
avoir
that
un
by
très grand
January
nombre de
1st,
cas,
we
ce
could
qui
see
souligne
a
la
daily
nécessité
average
d'agir
of
de
as
toute
many
urgence pour réduire
as,
l'accélération.
or rather,
À l'heure actuelle, les
at the
tendances
current
des cas de
time,
maladies graves
the
augmentent dans les provinces
trends
les plus
of
touchées,
severe
ce qui a
illness are
commencé à
increasing
inverser la
in
tendance
hardest
nationale.
hit areas,
Au cours de
which
la
is
semaine
shifting
dernière, en
the
moyenne,
national
plus de
trend.
1500 personnes atteintes de la COVID-19
In the
ont été
past week, on
traitées chaque
average,
jour dans
over
nos hôpitaux,
1,500
dont
people
près
with
de
COVID-19
460
were being
dans les
treated
unités de
in
soins
our hospitals
intensifs
each
et
day,
17 décès ont été signalés chaque jour.
and 17
Bien que les
deaths were
tendances
reported
actuelles
daily.
puissent être un effet retardé
Although the
de
current trends
l'activité
may
accrue
be
du
a
variant
lagging
Delta au
impact
cours des
of
semaines
increased
précédentes,
Delta activity in the
l'accélération
preceding
rapide de
weeks,
l'activité du variant
rapid
Omicron
acceleration of
devrait
Omicron
également avoir des
activity is
répercussions
also
sur ces
expected to
tendances,
further
même
impact
si le
these
variant
trends,
Omicron
even
s'avère
if
moins
Omicron
grave.
turns out to be
Nous sommes
less severe.
particulièrement inquiets des conséquences
We are
potentielles
especially
d'une forte
worried
et soudaine
about the potential
recrudescence de
impact
la
of a
maladie sur le
sudden
système de soins de
and strong
santé.
surge
C'est
on the
pourquoi nous
healthcare system.
demandons vivement à
So
tous les
we are
Canadiens
urging
de
all
faire ce qu'ils
Canadians to
peuvent
do what
pour
they
atténuer
can
ces
to help
conséquences.
mitigate
Bien
this.
que la situation ne soit pas la
Although the
même partout,
situation is
ce
not the
variant se
same
propage
everywhere,
extrêmement
this
rapidement
variant
et la
spreads
situation
extremely
peut
quickly,
très vite
and the
devenir hors de
situation can
contrôle
rapidly get out of
n'importe
hand
où.
anywhere.
Alors que les autorités de santé publique
While public health
surveillent de près
authorities are
l'évolution de la
closely monitoring
situation,
the
nous
evolving
pouvons tous
situation,
contribuer
we can
à
all
réduire
help
nos contacts
by
le plus
reducing our
possible.
contacts as
En
much as
termes simples,
possible.
cela signifie
Practically
restreindre la
speaking,
taille des
this means
rassemblements le plus
keeping
possible,
gathering
par
sizes as
exemple
small as
en se
possible,
limitant à la
for
famille et
example,
aux
by
amis
limiting
proches
to just
que l'on
family
connaît
and
bien.
close friends who
Toutes
we
les
know well.
personnes admissibles devraient être
Everyone who is
entièrement
eligible
vaccinées
should get
et
fully
obtenir une
vaccinated
dose de rappel
and
dès
receive a
qu'elles
booster
le
dose
peuvent.
as soon as they
Et
are
chacun
able.
devrait utiliser
And
plusieurs couches de
everyone should
protection,
use
car
layers of
aucune mesure n'est
protection,
parfaite
since
ou
no measure is
applicable à
perfect
tous.
or
En
applicable for all
particulier,
people.
nous pouvons réduire les risques
In
d'exposition
particular, we
au
can
virus
reduce
et
the
de
risks of
propagation du
exposure
virus
and spreading
en
the virus
améliorant et en
by
maintenant une bonne
improving and
ventilation
maintaining
et en
good
portant une masque de
ventilation
bonne qualité
and wearing
et
a
bien
good
ajustée,
quality
tout en
and
restant
snug-fitting
flexible
face
s'il faut
mask
changer
while
les
remaining
projets à
flexible
la
if
dernière
plans
minute.
need to be
À
adjusted at
l'heure
the last
actuelle,
minute.
nous avons toujours besoin que
Currently,
beaucoup plus de
we
personnes
still
augmentent leur
need many more
protection
people to
avec les
increase their
vaccins contre
protection
la COVID-19.
with
Plus de
COVID-19
7 millions de
vaccines.
Canadiens admissibles
Over
ont
7
besoin
million
d'une
eligible
première
Canadians
ou d'une
need a
deuxième
first or
dose de leur
second dose
série
of their primary
primaire et beaucoup
series,
d'autres sont
and many
admissibles
more
à une
are
dose de
eligible to
rappel
get a
pour
booster
aider
dose
à
to help
rétablir la
restore
protection
protection
qui a
that
pu
may have
s'affaiblir
waned since their
depuis leur
second
deuxième
dose.
dose. Les doses de rappel des vaccins
Booster
à
doses
ARN
of
messager de Pfizer
either
ou de
Pfizer or
Moderna
Moderna
devraient être
mRNA
administrés en
vaccines should
priorité
be
à certains groupes,
prioritized for
comme
certain
les
groups,
travailleurs de la
such as
santé et
healthcare
aux personnes
workers
les plus
and
vulnérables aux
those
maladies
at
graves
highest
causées par le
risk of
COVID-19,
severe illness from
notamment les personnes
COVID-19,
âgées et
including
les
older
personnes atteintes
adults
d'affections
and
à
people
haut
with
risque.
high-risk medical
Bien que
conditions.
nous ayons tous à faire face à une certaine
Although we're
déception,
all
à
dealing
une
with some
réorganisation de
disappointment
nos projets,
and changed
j'espère
or
que nous sommes
disrupted
tous
plans,
d'accord pour dire
I
que
hope we
nous
can all
faisons ce que
agree
nous devons
that we're
faire
doing
pour les
what we
bonnes
need to
raisons.
do
En
for
plus de
the right
prendre les
reasons,
précautions supplémentaires
beyond taking
pour
extra
préserver notre
precautions to
santé,
safeguard our health
notre
and
santé
the
et
health
celle
of
de nos
our
proches,
family
nous
and
adaptons
friends.
nos projets
We're
afin de
also
protéger
adjusting
notre
to
système de
safer
santé
plans in
et de
order to
permettre à
safeguard our
chacun de
health system
traverser cette
and
période
get everyone
difficile
through this
beaucoup plus
difficult time
rapidement.
that much
Nous l'avons
faster.
déjà mentionné, mais je tiens à
We have already
remercier tout
mentioned this, but I
particulièrement
want to
nos travailleurs
especially
de la
acknowledge
santé et de
our
la santé
healthcare
publique.
and public
Ils ont
health
été là pour
workforce.
nous et ont fait des
They have
sacrifices
been there for us
quotidiens que
and
beaucoup
have made
d'entre
daily
nous ont
sacrifices
peine
that many
à
of us
imaginer.
would have a
Maintenant
hard time
qu'ils sont
imagining.
confrontés à ce que
Now that they are
pourrait être
facing
ce
what
jour la
could be
plus
the
grande et la
largest
plus
and
soudaine des
most sudden
répercussions,
impact to
à un
date,
stade où ils sont sans doute le plus
and at a
épuisés,
time when they
ils
are
doivent savoir
arguably
que
at their
tout le
most
monde
exhausted,
contribue à réduire
they need to
autant
know
que
that we are
possible
doing
la
everything
menace
we
qui
can
pèse sur nous
to
tous.
minimize the threat
Ce n'est pas les
facing us all.
vacances des fêtes que nous souhaitons,
These are
et
not the
cela
holidays
ne
we wished
signifie
for,
pas que nous sommes
but it
revenus au
doesn't
point de
mean
départ.
that we're back where we
Nous
started.
disposons d'outils plus nombreux
We have
et plus
more and
efficaces,
better tools in
notamment
the
des vaccins
toolbox,
et des doses de
including
rappel, une
vaccines
meilleure
and booster
connaissance de la
doses.
transmission
We have better
et de
knowledge
pensées
of
plus
transmission
précis sur
and
les mesures de
enhanced guidance
protection
on
individuelle,
individual protections,
ainsi
as well
d'un
as
plus
more
grand nombre
testing
d'options
options
de
and
dépistage et
improved
d'une meilleure
clinical
gestion
management
clinique et
and
de traitement.
treatments.
Au cours des prochaines semaines, nous
For the
devrons
coming
nous
weeks,
appuyer sur
we
ces
have to
outils
work
et
to
continuer
these
à
strengths
travailler
and
ensemble
keep
pour
working
franchir
together
cet
to
obstacle.
clear this hurdle.
Merci.
Thank you.
Thank you. Miigwech.
Thank you. We'll now move to questions. Just a reminder, one question, one follow-up, and heads up that the Prime Minister can take questions for 20 minutes. The other ministers and the doctors will stay after that. Thank you. So, operator.
Thank you. Merci. For questions, please press *1 on the device's keypad. Pour toute question, faites étoile 1 sur votre appareil. The first question is from Mike Lecouteur from Global News. Please go ahead. Your line is open.
Thank you for taking our questions. Prime Minister, if you forgive me and permit me a bit of a double-barreled question, since You gave us a bit of news, seeing that you said some of your staffers and member of your protective detail have tested positive. So on the first side, I wanted to know, have you taken a PCR test or rapid test to check your status and share that with us? But also, many Canadians are having these difficult conversations with their family ahead of Christmas. So what was the conversation like in your household with your kids and family, seeing as how you likely had to change how your holiday plans will play out?
Thanks, Mike. First of all, we are following all public health guidelines every step of the way. The members of my staff and detail who have tested positive are following public health guidelines, as am I, as are everyone. I have been taking rapid tests, so far negative, but following public health guidelines, I'm being careful about everything that I do, which is part of the reason why we're in virtual today. Secondly, a lot of people are having very difficult conversations. Nobody wanted to be in here right now in this situation. We were looking forward, now that 80% double vaccinated in Canada, we were looking forward to a bit of a respite, a time to gather as families and friends at the holidays and celebrate what looked like perhaps the beginning of the end of COVID. And then Omicron came and changed that for everyone. And nobody wants to be in this situation. But we know what to do, Mike. And yes, there have been lots of conversations about not seeing friends, not gathering for New Year's, not gathering outside of immediate family for Christmas in our household, like in a lot of households. But quite frankly, there's a lot of people for whom those conversations around having more restricted holiday gatherings are still better news than what a lot of Canadians are facing. People who will be totally alone for Christmas, people who are facing significant health challenges, people who are dealing with mental health issues that have been exacerbated by the past 2 years of extraordinary difficulty. Most of us will just have a slightly smaller number of gatherings and contacts through these holidays, which we'll survive through, won't be all that great. But let us think of those people who are working in our hospital rooms, in our critical care facilities, out there giving vaccinations and boosters, and continuing to do everything they can to keep us safe, for whom this holiday will be more difficult and, quite frankly, will determine just how difficult the entire winter will be.
And just as a follow-up, when you talk about the announcement of the expansion of the benefits, things have been moving very quickly, probably more quickly than we have at any point during this pandemic, but it's also not our first wave. How is it that some feel that we're still behind the eight ball here, we're playing catch-up with Canadians not being able to access the programs they need in the timely fashion they need, because a lot of people feel like they saw this coming, but the benefits weren't there yet?
We saw this coming. We saw the potential for this coming, which is why we put forward Bill C2, Bill C3 measures to support people. We are glad it got passed at the very end of the parliamentary sitting. We would have liked it to have been passed earlier, but having been passed now, we're able to adjust the regulations a little bit so as where it was created in case of localized lockdowns, that there be supports. Now we're expanding it so that it's there for places with reduced capacity. So we have the measures in place. Sure, we would have liked to have been able to pass them quicker in this Parliament, but as you know, Mike, Parliament moves at its own speed, but at least they are in place now so we can be delivering those supports to Canadians as quickly as possible.
Thank you. Merci. La prochaine question nous vient de Boris Proux, Le Devoir.
Next question from
À vous la
Boris
parole.
Proux from Le Devoir.
Bonjour,
Over to you.
question très simple. Est-ce
Good
que
day. Very simple
l'élargissement de
question.
l'accès aux aides
On
aux
the
entreprises
expansion to business aid
s'applique
measures,
maintenant aux entreprises qui ont été créées durant la pandémie?
does it apply to businesses that were created during the
Bonne
pandemic?
question. Je vais passer la
Answer. Very
parole
good question.
à
I
la
will hand it
vice-première
over
ministre.
to the Deputy Prime Minister.
Monsieur le Premier ministre,
Thank you,
la
Prime
réponse
Minister.
est non.
The answer is no.
On utilise la même plateforme,
We are
les mêmes
using the
règles
same
qu'on a
platform and the
utilisées
same
pour
rules
les subventions
as we
salariales et les
used for the
subventions pour
wage
le loyer.
subsidies and the rent
Alors, ce sont
assistance.
des programmes pour les
So
entreprises
these
qui
are
étaient là
programs for
avant le
businesses
début de
that
la
were there
pandémie, les
before the
entreprises
beginning
qui
of the
étaient créées
pandemic,
quand
businesses
personne
that
ne
were
savait
created when no one knew
qu'on aura cette expérience
that
de
we
la
would
lutte contre
be
une pandémie.
experiencing this fight against a pandemic.
Merci. En
Thank
suivi,
you.
qu'est-ce
As
qui
a
est prévu
follow-up
pour ces
question,
personnes à
what
qui
has
on a
been
demandé
planned
de se
for those
renouveler
people
et qui ont
whom we've
qui se sont lancés en
asked
affaires? On a parlé à plusieurs personnes là, qui se
to
sentent complètement
renew
démunies de
or
ne pas
to
pouvoir bénéficier d'aide.
dive back into business?
Qu'est-ce que vous leur dites finalement
What
à
do
elles
you
qui ne
say
sont
to
toujours
those
pas
people
admissibles à ces
who are
nouveaux
still
programmes
not
d'aide?
eligible for these new aid programs?
Je dirais
Answer.
premièrement que,
First
comme
of
le
all,
Premier ministre
I would say
a juste expliqué, la
that, as the
chose
Prime Minister just
importante de
explained,
constater,
the
c'est que
important
le
thing
Canada
to
est
note
prêt,
is that
que
Canada
même en
is ready,
octobre, quand
that even in
personne ne
October,
savait
when no one
ce
knew
qu'était Omicron,
what Omicron was,
on a compris que c'était
we
nécessaire
understood
d'avoir une police
that it was
d'assurance.
necessary to have an
On a
insurance
compris
policy.
que la lutte contre la COVID
We
n'était pas
understood
finie
that
et
the
que ce
fight
sera
against COVID
nécessaire
was
d'avoir
not yet
les
finished
outils
and that
pour
it was
répondre en
necessary to
manière
have
très vite
tools to
à
respond
une
very
nouvelle vague de
rapidly
la COVID.
to a new
Et
wave of the
c'est ce
pandemic.
qu'on a fait,
And that
commençant
is
en
what we
octobre.
did
Et ce sont
as we
les
saw
nouvelles
in
mesures
October, and
qu'on a
these are new
annoncées
measures
aujourd'hui.
that we are announcing today.
C'était toujours le cas que oui,
It was always
on
true
est là
that,
pour les entreprises,
yes,
on est
we
là
are there
pour
for
les gens, on est
businesses,
là pour
we are there for
soutenir
Canadians,
l'économie.
we are
Mais
there
on
to
doit
support the
avoir
economy,
une approche qui
but
a
we
de
must have
l'intégrité. On doit
an
avoir
approach that
les
has
données avec
integrity.
lesquelles on peut faire une
We must
comparaison. Et
approach the
nous
situation
trouvons que
being able
l'approche la
to
plus
compare
juste,
data, and we
c'est
find that the
d'avoir une
fairest
approche
approach
qui a une comparaison avec
is
les
one
revenus qu'on a maintenant
that
et
uses a
celles qu'on a
comparison
eues
between
devant le
current
début de la
revenues
pandémie.
with revenues before the pandemic.
Thank you. Merci. Next question is from Mackenzie Gray from CTV News. Please go ahead. Your line is open.
Hello, Prime Minister. In Ontario and a number of other provinces right now, the testing system has essentially collapsed. There's multi-day waits to get a PCR test. People are lining up at 5 o'clock in the morning even to get a chance to get a rapid test. And for boosters right now, it's basically Hunger Games to try and get a shot. We're 2 years into the pandemic, basically. So how is Canada in such a terrible position right now?
Well, first of all, Mackenzie, on rapid tests, as of the beginning of December, we'd sent out 85 million rapid tests to provinces and territories. That's over the past year. Not all of them have been used, and there were many stockpiled. We're delivering more rapid tests now, 35 million throughout this month, with tens of millions more. There are provinces and territories, I think of particularly Nova Scotia, that has been doing an exemplary job of using rapid testing in communities, in commercial businesses, sharing them with Nova Scotians in a way that has allowed for a regular monitoring of people's conditions. Other provinces are now starting to do that, which is a good thing. The federal government, as we promised to, is procuring millions upon millions, over 100 million rapid tests and sending them to the provinces. All told, we will be doing more to make sure that rapid tests are getting out there for people. It is a matter of provincial and territorial distribution to get those rapid tests into people's hands so that they can use them. In regards to boosters, when we signed our vaccine agreements, we updated them with advanced purchase agreements for vaccine doses, tens of millions of vaccine doses into 2022, into 2023, and indeed beyond. That's why we are in such good situation right now in terms of boosters. We have enough boosters in Canada for everyone who is eligible to go get themselves boosted, to get themselves fully vaccinated. Obviously, there are pressures on distribution, on getting those into arms as quickly as possible, and provinces are in charge of that, but we will, of course, look to be helpful in any way. But in terms of booster supply, the federal government is there.
Just in terms of the potential COVID situation that you might yourself be in, just a little bit more clarity from it if you can. Are you self-isolating at this point in time right now? And of the 6 people that are on your staff and with the RCMP, have any of them deemed to be close contacts with you? Have you been in close contact or meeting with them at any point recently?
We've been working very, very closely on all the details of the current situation with experts from public health, with the top public health officials, both in Ottawa and across the river in Gatineau. So far, the recommendation is that I self-monitor, that I do rapid tests, that I do testing regularly. So far, it's all been negative. You will know if ever it becomes positive. I promise you that. And also to try and reduce my contacts as much as possible. But it is not the recommendation from public health at this time, given the nature of the contacts with my staff, that I go into full isolation. But of course, we're going to continue to monitor and follow those public health guidelines to the letter.
Thank you. Merci. La prochaine question, Julie-Anne Lapointe, Radio-Canada.
Next question from Julie-Anne Lapointe from Radio-Canada. Over
Bonjour,
to you.
M. Trudeau.
Mr. Trudeau.
Pourquoi ne pas fermer carrément les frontières étant donné les inquiétudes à l'heure actuelle? Est-ce que ça demeure aussi une option qui est toujours envisagée?
Is that still an option on
On
the
est
table?
toujours ouvert à n'importe quelle option qui
We are
va
always
garder les
open
Canadiens plus en
to any
sécurité. On
option
a
that can
démontré
better
cela.
ensure
Mais la
Canada's
réalité,
safety.
c'est que
We have already established that. The current reality is that Omicron is already present
et de
in
fermer
our
les
communities
frontières
throughout the country.
maintenant
Therefore,
ne serait pas une
shutting
mesure
down the
efficace.
borders
Comme on
at
a
this
vu
point would not be an
pendant
effective measure.
les vagues précédentes,
As we saw
les arrivées à la
during
frontière
past waves,
représentent une infime
arrivals at the border
partie de la transmission de COVID,
an extremely
de se
small
concentrer
percentage
sur
of COVID
l'interdiction et
cases.
de communication ou qu'on répande la COVID le plus possible pendant le temps des fêtes dans les communautés. C'est là où on veut plus mettre nos ressources. Et c'est à ce niveau-là qu'on est en train de faire tout le travail nécessaire. Mais comme j'ai dit, on va suivre la recommandation des sciences de la santé publique par rapport à ça. Mais de fermer les frontières à ce moment-ci, ça n'ajouterait pas grand-chose pour beaucoup de perturbations parce qu'il faut toujours souligner qu'un citoyen canadien ou un résident permanent peut en tout temps revenir au
we also must
Canada.
remember that a
On ne
permanent
peut pas
resident or
fermer les
Canadian citizen
frontières
has the
aux
right to
citoyens.
return home
Ils ont
at
toujours
any
le droit de
time.
venir
We
et
cannot close
la
the border
réalité, c'est
to
qu'on est
Canadians.
mieux
They
de
always
se
are
concentrer
allowed
sur
to come home.
l'interdiction de communication dans nos communautés. Mais
So we are
je suis content
focusing
de passer la
more
parole
on
au ministre de la Santé
communities.
pour
Now
en
I
dire
can
plus.
also hand it over to the Minister of Health.
Oui, merci, Monsieur le Premier ministre.
Yes, thank you, Prime Minister.
J'ajouterais qu'au Canada, par
I would
rapport à
also
tous les pays
add
comparables dans
that
le
in
monde, nous
Canada,
avons toujours eu durant la COVID-19 et nous avons encore les
and
mesures
this has been
frontalières les
true
plus strictes et les
since the
plus
beginning of the
efficaces.
pandemic, we
Et
have,
ça, c'est parce qu'on a
compared to other
plusieurs
countries,
couches de
some of the
protection.
strongest
Il y a une
border
couche très
measures
importante que je
of
rappelle
any
brièvement,
country.
c'est la couche de test avant l'arrivée
I would
au
like to
pays, qui est une
stress
couche
an
uniforme qui
important
s'applique à tout le
layer
monde,
of
peu
protection,
importe
which is
d'où ces
testing
gens peuvent
before
venir et qui ils
coming
peuvent
into the
être.
country,
Une couche additionnelle qu'on a
which
mis
is
rapidement en
required.
place
And that
il y a
was a
quelques
layer of
semaines qui est
protection
à
that
peu
we
près complète
quickly
maintenant, qui est la couche
implemented.
de test à l'arrivée. Donc,
And we
une couche,
also
alors que dans la
put in
plupart des
place
pays
another
du
measure,
monde, il y
which
a
is testing
encore parfois
upon
zéro
arrival.
couche de protection. Alors, on a
So
fait
we
ça.
are using a
Et la deuxième chose que
multi-layered
j'ajouterais rapidement,
approach.
c'est en appui à ce que M. le Premier ministre a dit, c'est
And
que
I also support what
la
the Prime
transmission
Minister said,
communautaire,
that is
encore
that
plus
community
que pour les
spread
autres variants, la transmission communautaire pour le
now
variant
even
Omicron,
more
c'est
than
la
for
transmission la plus
prior
importante en
variants,
raison
including
de la
Delta,
contagiosité de l'infection. Le
is
caractère très
what we're focusing on,
contagieux du nouveau
and that is in
variant,
part
c'est
because
ça
of the
qui
very
mène les cas
transmissible
présentement, c'est
nature
les
of the
contacts entre
Omicron
les gens
variant.
au Canada. Et c'est pour ça qu'on insiste beaucoup
That is
sur la
why
réduction des
we
contacts
are
que les gens doivent faire à très court
focusing
terme.
on short-term contacts.
Et question de suivi, toujours pour M. Trudeau.
Follow-up
Vous
question,
avez eu
still for
vous-même
Mr.
des discussions
Trudeau.
sur vos plans pour le temps des fêtes.
You
C'est un
had
peu
to
le jour
change
de la
your
marmotte,
holiday
sauf que là, on est
plans.
déjà vaccinés.
It's like Groundhog Day, except this time we're
Est-ce
vaccinated.
que vous avez dit vous-même à
It
vos
doesn't seem like
proches,
there's
qu'est-ce
a
que vous
miracle
diriez aux Canadiens
solution?
qui sont
What would you say to
découragés face à
Canadians
ce
who are
qui nous
feeling
attend pour les prochains mois?
discouraged when they look to the coming months?
You might be on mute.
You might be on mute.
Excusez-moi, je
I'm sorry
reprends.
about that.
Je comprends à
Let
quel
me try
point
again.
les gens peuvent être
I
épuisés
understand
et tannés par rapport à la
how
COVID-19.
exhausted and
Je comprends, il n'y a pas
sick of
personne qui voulait
COVID
être dans
people
cette
must
situation-ci.
feel. I
Mais en
know that
réalité,
no one
nos
wanted to end up
travailleurs de
in
la
this
santé
situation.
sont encore plus épuisés,
But I
sont
would
encore
like for
plus
people to
tannés
keep in
par la
mind that our
COVID-19.
healthcare workers are even
Ça
more
fait 2 ans presque
exhausted
qu'ils travaillent
by the
extrêmement fort pour nous
pandemic.
garder en
For them,
sécurité.
they have been working extremely hard for
Difficile pour bien des familles
for
comme
2
la
years
nôtre
since the beginning of the
de se
pandemic.
rassembler avec
And I know
juste
it is
les
difficult
plus
for all
proches,
families,
mais
not
c'est ce
just
que
my
nous devons
own,
faire. On va avoir
to
des
decrease
moments
gathering
au
sizes and to
printemps, à
only
l'été
see
pour se
very
rassembler
close family
si et
members.
seulement si on fait attention pendant
But we
ces temps des
need
fêtes.
to
Il faut
be
continuer de
careful
faire les
during
bonnes
this
choses de la
holiday
bonne
season.
façon.
We must
Il faut
continue to do the
continuer
right thing,
de faire ce qu'on
to do things
sait quoi
right,
faire. On sait comment le
and to
faire,
do
de
what we
réduire les
know how to
contacts,
do.
de
We
continuer à
know
se
how to
faire
reduce our
vacciner,
contacts.
d'avoir les doses de rappel, d'assurer la
We must
vaccination de
continue
nos
to
enfants,
be
porter
vaccinated,
les masques,
to get our
réduire nos
booster
contacts.
doses,
C'est toutes
to
les
wear our
choses qu'on
mask,
a su comment faire
hand
et qu'on
hygiene,
va pouvoir faire
etc. These
encore
are
une
all
fois. On
things
va
that we
passer à
have known
travers.
how to do and will help us get through this.
Thank you. Merci. The next question is from Jordan Press from the Canadian Press. Please go ahead. Your line is open.
Good afternoon. Prime Minister, just a moment ago, you said that we were prepared for the potential for this to happen when you talked about the benefits. And yet it seems that in many parts of the country, despite warnings that Omicron was coming, it seems that there's been, from what many people would believe, is a failure of the system. When you think of, for instance, testing capacity, as one of my colleagues asked about. So I'm wondering, given your comments, if you believe that it is really the provincial and territorial governments that have dropped the ball on this. And if not, how much responsibility does the federal government then shoulder for the failure that we are seeing now of the system that seems to have been unprepared for Omicron despite the warnings?
No, that's a very good question, Jordan. The reality is we have all been working flat out and learning much about COVID over the past 2 years, and indeed bracing for Omicron. When Omicron started to hit, we took immediate measures at the border to try and slow the arrival of Omicron, which I think probably bought us a little bit of time. But even before Omicron's arrival, we were there on stepping up to order enough boosters into 2022 for all Canadians, which is why people can be comfortable going to get that booster shot that does provide protection against Omicron as quickly as possible so that we can stay safe. We have continued to order rapid tests. We ramped up our ordering of rapid tests actually in the fall of 2020. And over the past year, we have delivered close to 100 million rapid tests to the provinces. We're continuing to order even more. There will be more. Questions around distribution, questions around speed and ease of access are more properly given to the provinces, but we will be there to support. Like I've said, the example of Nova Scotia as a place that has adopted early and rapid use of rapid testing. It was just something that they were ready for, and therefore have seen positive results from. But Omicron is here, and we're just going to have to hunker down and be careful. The measures that we put in place to support businesses, like I said, we saw that as a need for local lockdown potential through the winter. But because we put those measures in place, we are able to adjust them so that they are broader based and able to affect more people given the scale of this Omicron wave.
And as my follow-up, I'd like to ask you about President Biden's speech yesterday, because he obviously, the messages that American presidents deliver have long been heard in Canadian living rooms and homes, despite the fact they don't govern Canadians. And yet I'm wondering what you make of what he said, of what President Biden said yesterday as far as the holiday season, and how much do you think that will resonate with Canadians and some of the decisions that they may make, given the message you're delivering today?
Canadians are among the most vaccinated people in the world. Americans have a much lower double vaccination rate, which is certainly something that the president no doubt had on his mind as he was, touting the benefits of being vaccinated. But we know, and I'll turn to Dr. Tam right after this, we know that Omicron can break through double vaccination, which is why it is so important to get that third booster shot. It spreads much more quickly, it is more contagious, but vaccination will prevent people to a large extent from getting into the ICU, from getting the severe outcomes. So vaccination is still a really, really important part of our pillars of defense against COVID, against Omicron, but it's not the only thing. What we need to do on top of being so well vaccinated as we are is get those booster shots and make efforts to reduce our contacts during the holiday season, reduce the spread of Omicron so we prevent our healthcare systems from getting overwhelmed. Even if, as it's starting to show, perhaps a lower percentage of people who get Omicron get into critical care, if the numbers skyrocket, that'll still be enough to overwhelm those healthcare workers who've been working so hard. So we need to know that getting vaccinated, getting your boosters, and being safe in the choices we make as we gather is how we get through this. The good news is Canadians have done it before. We've done it through the difficult waves. We know what to do. We know it gets better afterwards. We're just going to have to hunker down for the coming weeks as it'll prove to be a difficult winter. But I'll turn to Teresa right now to add or complete anything that I just said.
Well, that was a very comprehensive answer from the Prime Minister. I think we need to focus on how to manage this particular wave and this variant by focusing on reducing impacts on the health system and reducing the severe outcomes. I know that it's very difficult with a very rapidly escalating transmission going on with Omicron, that we can't prevent every case. We can't actually detect every case necessarily because of the sheer numbers from the provinces and territories. So the key thing is please focus on preventing any further impacts on the highest risk, the long-term care, the hospitals, making sure our healthcare workers are protected in any high-risk populations, and line up in a orderly manner, if you like, to get the boosters, because we want the highest risk to get protected first. That is the prime objective, and that can be done very easily. The doses are there. I think one particular point I want to make is that it's not just about numbers of vaccines or tests. We have a finite human health resource capacity. And so this is why we're doing what we're all doing now, so that people can get their boosters in a very organized manner, as well as making sure the tests are there for the high-risk populations.
So I'm told we are over time with the Prime Minister, but maybe we have time for one more, if that's okay, operator, for the PM.
Thank you. La prochaine question va être alors de Olivier Ferron-Boisé, TVA Nouvelles. À vous la parole.
Boisé. Over to you.
Oui, bonjour. Merci, M. Trudeau, de prendre une autre question. Je veux vous parler de la demande de Québec pour les forces armées canadiennes, mais cette fois, c'est pour aider à la vaccination. Quel type de ressources on a au sein des forces? Quelle ampleur en termes de nombre pourrait être déployée? Et quand on pourra avoir un déploiement des membres, mais aussi de d'autres ressources fédérales, parce que dans la demande de Mme Guilbeault, on parle aussi de ressources de d'autres organisations fédérales. Est-ce qu'il y en a ailleurs dans l'appareil fédéral qui peuvent insérer des aiguilles dans des bras?
Non, merci Olivier pour la question. C'est sûr que, comme on l'a fait depuis le début, on va être là pour aider les provinces et territoires qui font face à des situations difficiles, que ce soit avec la Croix-Rouge, que ce soit avec les forces armées canadiennes. On est justement en train de coordonner le plus possible pour être là, pour aider les provinces en difficulté. La réalité est différemment des vagues précédentes, c'est que Omicron est en train de frapper partout en même temps. Et on n'a pas des ressources infinies, donc il va falloir qu'on fasse des choix pour mieux aider. À ce niveau-là, on est en conversation avec Québec et avec d'autres provinces pour vraiment regarder de quelle façon on peut aider avec le plus d'impact, sachant que nos ressources à travers le pays sont limitées. Mais peut-être Jean-Yves, tu es en train de regarder ça attentivement aussi.
Jean-Yves is looking at this closely as well.
Effectivement, les ressources du gouvernement canadien sont évidemment limitées. Le gouvernement canadien a aussi des responsabilités envers les peuples autochtones et envers des communautés éloignées et certains territoires en particulier. Troisièmement, les provinces sont toutes, comme le disait le Premier ministre, dans une situation ou bien identique ou bien de plus en plus semblable. Elles ont toutes évidemment besoin d'aide et on est ouvert, on travaille très bien avec elles. On est en contact hier encore ensemble. J'ai parlé au ministre hier pour être sûr de bien comprendre les besoins, parce que la quatrième chose, c'est effectivement ça. C'est qu'on est en conversation avec eux pour bien saisir les besoins auxquels on pourrait rapidement et efficacement répondre en collaboration
and effectively in cooperation with the other regions.
Merci.
Thank you.
En suivi, si jamais vous avez une approximation du nombre qui pourrait être déployé et ou des dates auxquelles ça pourrait être très apprécié, mais sinon, pour mon suivi, les États-Unis qui ont approuvé aujourd'hui le traitement antiviral de Pfizer qui permettrait de réduire les hospitalisations. Le processus est toujours en cours à Santé Canada. On a des ententes pour en avoir jusqu'à 2 millions. Est-ce que c'est réaliste de penser qu'on pourrait s'en servir dans cette vague-ci comme un outil pour réduire les hospitalisations qui sont vraiment au nerf de la guerre, qui sont la cause des mesures qui sont prises en ce moment à la province de Québec?
Je viens d'avoir un briefing là-dessus. Je peux vous assurer que Santé Canada est en train de travailler extrêmement fort pour faire l'évaluation nécessaire pour pouvoir approuver les choses le plus rapidement possible. Mais encore une fois, je suis content de tourner la parole vers le ministre Duclos, le ministre de la Santé.
Tout à fait. Donc, deux bonnes nouvelles, c'est que Santé Canada fait ce travail présentement en collaboration avec d'autres pays qui, comme vous le dites, font exactement le même travail. Deuxième chose, c'est qu'on a des contrats d'approvisionnement solides qui ont été signés il y a quelques semaines, 1 million de traitements de Pfizer, 500 000 pour Merck. Ça, ce sont des traitements. Donc, ce sont le nombre de gens qui pourraient profiter de ces traitements. Chaque traitement, c'est 10 doses, 2 doses par jour durant 5 jours. Donc, ça va bien à la fois sur le plan réglementaire et sur le plan de la réglementation.
These are still being assessed.
Okay, thank you to the Prime Minister. We'll stay with the other ministers and the doctors for another 20 minutes. Thank you very much. Operator.
Thank you. Merci. The next question will be from Marika Walsh from the Globe and Mail. Please go ahead. Your line is open.
Good afternoon. I wanted to revisit the question that Jordan Press first asked the Prime Minister. The message from the U.S. Administration to Americans, where they have a lower vaccination level, much lower, is don't panic and enjoy the holidays if you're fully vaccinated. And I'm wondering what you expect Canadians to make of the fact that your message almost seems to be borderline to be at least very worried, if not panic. You're telling people to reduce contacts to immediate family and friends only. You're urging people to cancel their holiday plans. I'm wondering how you explain that difference to Canadians who consume so much U.S. news.
I will take a stab at that question to begin with, and then perhaps Jean-Yves will want to elaborate. Look, Canada is not the United States. And I think all of us know that very profoundly. And our countries have taken very different approaches in the fight against COVID. I know that this is a really hard time for everyone in Canada, but I think also we should take some comfort and draw confidence from the fact that when you compare how Canada has done to the way that other similar peer countries have handled the fight against COVID, Canada has done pretty well. We have the second lowest mortality rate in the G7. That's really meaningful. We, by sticking together, by supporting each other, by being resilient, we have managed to save a lot of lives, and we've kept our economy really intact as well. Now, the one thing I do want to sort of strongly push back against is this notion that the federal government, and I would also say provincial governments too, that any of us are in any way offering a counsel of panic or a counsel of despair. That is totally not the case. Quite the contrary. I think Canadians should be reassured by the fact that we are ready for this as a country. We have the economic support measures in place. And actually, we thought about it beforehand. And already in October, we put in place laws with flexibility that are allowing us to respond really quickly to this situation. We have been ordering boosters, rapid tests, and therapeutics for precisely this situation. In the fall economic update, we provisioned the money to pay for all of these supports. And as Jean-Yves has been quite rightly emphasizing, as a country, we've done really well, not just on buying vaccines, but on all of us getting vaccinated. And as you see from the experience of many countries, that is not so easy to do. So I think as Canadians, we should really feel reassured by our demonstrated national capacity to handle COVID, by our demonstrated national resilience, by the fact that we have the tools, both economic and the health tools, to handle this, by the fact that provinces and territories and the federal government are working very closely together on this. I know Jean-Yves is in constant touch with his provincial and territorial colleagues. I'm working closely with finance ministers across the country. So, you know, the message that we want to share with Canadians is, yeah, this is really, really hard. And it's coming at a time when we're all tired and when we were looking forward to really kicking back and relaxing. But we have done really well as a country so far. We are resilient. We're a careful country, and I think that's a really good thing. And I think all of us need to be careful. I think we all know that. And I'm confident that we will be. And I am really confident that we're resilient and we'll get through this. And I think that is the message from the Government of Canada, from all levels of Canadian government leaders to Canadians. And I have to say, you know, in my own neighborhood, that's exactly how I see people behaving, responsibly, carefully, in a really intelligent way, thoughtful about their own health, the health of their friends and family and their community. Jean-Yves, peut-être tu veux ajouter quelque chose.
Jean-Yves, perhaps you would like to add
Well,
something.
very quickly. Indeed, we have been relatively successful It's never perfect in any particular country, but if we compare ourselves to many other countries, as Minister Freeland said, we have been very successful on all sorts of fronts, including, as she mentioned, our ability to protect the health and safety of Canadians. She mentioned that we have had a lower death rate than other countries. In the United States, their death rate is 3 times of what we have seen in Canada. That means that had we had the same death rate as we have seen in the United States, we would have had 60,000 more people dying of COVID-19 in Canada.
Thanks for that answer. I just want to follow up on that because it seems the message from the U.S., just to challenge the Deputy Prime Minister, is not to panic and to enjoy your holidays. The message from Canada is clearly not that. And at the same time, the message from the U.S. is they are doing everything possible to avoid lockdowns, whereas your message today is on how the government is preparing for lockdowns and restrictions. And going to the government's responsibilities federally, I understand that provincially it's where the healthcare rollout is possible. But as the government watched the provinces sit on rapid tests for the last almost 2 years, why didn't the federal government take initiative and, for example, ship out tests directly to Canadians through the CRA or Post Canada or Elections Canada?
So, Marika, let me take on that question. And again, I'm just going to start by saying Canada is not the United States. I think we are all very, very aware of that. I think we are aware of and proud of the sovereign choices our country makes. And our country makes very different choices from the US, from many other countries on a lot of different issues. I do really want to emphasize, because you've used the word panic, I want to emphasize to Canadians that is in no way the attitude our government is taking. In the many conversations I have with provinces and territories and municipalities, that is in no way their attitude either. But we are taking an approach which is careful, which is prudent, which is focused on following the science, which is focused on saving lives. From the economic perspective, as finance minister, let me tell you that we have understood from the beginning of this pandemic that the strongest economic policy was a strong healthcare policy, and we are continuing to take that approach. We very much understand and respect the responsibility that provinces and territories have for healthcare and for making decisions about public health, and also at the decisions that public health officers make at even more local levels. They are there, they are on the ground. We do, however, at the federal level, know how hard it is to make those decisions, how hard it is for provinces and territories and municipalities to choose to restrict what businesses can do, what people can do. And so our support measures announced today are there to help public health officials at the provincial level, at municipal levels, to make the right decision to preserve the health of Canadians. And I'm very glad that we have put in place for ourselves the legislative tools to offer that support, that we have the balance sheet to offer that support, that we have thoughtfully and carefully provisioned in the fall economic update to offer that support. That is the Canadian way. We believe in resilience. We believe in supporting each other. And that's what we've done since the beginning of COVID. That's going to be what we continue to do. Jean-Yves, est-ce que tu veux ajouter quelque chose?
Jean-Yves, would you like to add anything?
No, I think you've said it really well, Krista.
Thank you. Merci. The next question is from Rafi Boudjikanian from CBC News. Please go ahead. Your line is open.
Thank you. This is for the health minister. We're seeing the province of Nova Scotia pretty much abandon using the federal COVID app, saying the uptake was very low, so they're relying on people who test positive to contact their own close contacts. In the whole country, we've seen more than 1.9 million infections. You've only got about 37,000 uses of the app. What would you say now to Canadians who are wondering what is the best way to contact trace for COVID, and what improvements would you seek to make to the app, if any?
Well, thank you for the question. I would point out first that all of these tools are complementary. They are never identical. They work in different manners, and all of them end up very useful as a set of tools. So the app is not obviously the only way by which people can both monitor and follow up on their contacts. That's obviously a key thing to do right now, given the large size of transmissibility of the new variant. The variant being very transmissible, the importance of following up on contacts, either through the app or through other measures, is extremely is paramount. So it's all about reducing contacts, protecting ourselves when we do have contacts, and if we get infected, making sure we share that information with others using the app or other tools. Now, this being said, as we also alluded to earlier, there are challenges in provinces and territories doing all of that work in a manner in the size with which Omicron is spreading across Canada, and the federal government is there to help and is going to continue to be there to help through procuring and distributing tools and resources such as the app and personal protective equipment and tests, rapid tests included, vaccines, boosters, and all sorts of other things, understanding again that this is complementary to other tools that provinces and territories will also want to use.
Thanks. And my follow-up question is to Minister Freeland. You announced the one-time payment for seniors who've had their guaranteed income supplements clawed back because they took pandemic supports. Critics are worried this money won't show up until May, that the uncertainty around when the payments will come is not only causing anxiety for seniors, but it's also resulting in some of them making some pretty hard choices, living in their cars or choosing to buy food over needed medication. Can you clarify when the one-time payments will start rolling out for seniors?
Thank you for the question. I am very conscious and very concerned about the difficulties that seniors who are eligible for the GIS but also got support from the CERB are facing. And it is precisely because our government shares the concerns that many people have and has been listening to those seniors that I made the announcement last week in the economic update that we would be making payments to those seniors to compensate them for that GIS which they lost. It is technically something quite challenging to do, just given the different payment systems the federal government has. I would like to assure seniors, though, that we're aware of their needs. Seniors who qualify for the GIS are among the most vulnerable people in Canada. And we are working really, really hard to get this done as soon as possible.
Thank you. La prochaine question est de Mylène Crête, La Presse.
Next question from La Presse.
Oui, bonjour. Concernant l'aide des forces armées canadiennes, je me demandais combien de provinces cette semaine ont officiellement demandé cette aide et est-ce que les forces armées canadiennes ont vraiment suffisamment de capacité de ressources humaines pour aider à la vaccination?
To assist in vaccination?
Et merci beaucoup pour la question.
Thank you very much for the question.
Tout d'abord, au sujet des provinces et des territoires,
now, regarding provinces and territories, my team and myself
Blair,
also
évidemment,
Minister Blair, of course,
en lien, le ministre Anand,
and
sûrement sont
Minister
en lien
Anand
avec les différentes provinces et les territoires. J'ai
are all in
moi-même eu
communication
une très
with
bonne
the
conversation avec le
provinces
ministre
and
Dubé
territories.
hier directement pour
I mentioned
comprendre,
my
bien
conversation with
comprendre les
Mr.
besoins
Dubé yesterday.
dont les provinces et territoires et le Québec veulent nous faire part. Et là, donc, rapidement, si je passe à la question qui est complémentaire sur les Forces armées canadiennes. Les Forces armées canadiennes ont des capacités limitées en termes médicaux. Beaucoup des capacités des Forces armées canadiennes sont déjà déployées
And
dans
many
les
of
communautés
the Army
autochtones, dans les
resources
territoires,
are
les
already
communautés
being used, have already
éloignées.
been deployed
Mais
in
même si ce n'était pas le
Indigenous
cas,
and
étant
remote
donné
communities. But even if that were not the case,
de notre pays et l'ampleur des besoins, il est
the
clair qu'on ne peut pas
magnitude of our country and the magnitude of the
médicales
demands
des Forces armées canadiennes pour répondre aux besoins médicaux
means
entre
that
autres,
we are
le
not
besoin de
necessarily
vaccination
able
des
to use
provinces
the
et des
Canadian
territoires.
Armed
Et c'est pour
Forces,
ça qu'on
the medical
travaille aussi, et
resources,
c'est une excellente nouvelle, avec la
as
Croix-Rouge
much as is being
canadienne qui a
asked. That
des
is
liens et des
why
contrats
we are working
directs avec le
with the
gouvernement
Canadian Red Cross
canadien. On essaie de
also,
voir de quelle manière notre financement qui est accordé il y a déjà un peu de temps peut être utile pour appuyer le Québec et d'autres provinces
which will
et d'autres
also be
territoires
helping Quebec,
avec le
other
ministre
provinces
Dubé.
and
Je
territories.
sais que des conversations semblables
With
ont eu lieu
Minister
entre le ministre
Dubé,
Guilbeault et
we
mon collègue le
discussed
ministre
this,
Blair. On voit
and I
aussi de
know
quelle
that
manière
my
d'autres
colleague Minister
appuis
Blair has also had
pour
similar
aider à la
conversations
gestion
to see
complexe de ce qui est en train de se passer
what the
en
best
matière de
approach
vaccination
is to
au
tackle
Québec.
the
Donc, des
complex
appuis plus
vaccination
logistiques,
situation,
opérationnels,
including
non
in
médicaux
Quebec.
pour être fournis rapidement et
So
efficacement au
non-medical
gouvernement du Québec.
related resources can also be deployed for
Ma
the
deuxième
provinces.
question serait pour la
Follow-up
santé
question.
publique fédérale.
My second question is
Qu'est-ce
for
qui explique la
federal public
différence
health.
dans le
What
nombre de
explains the
cas au
difference
Québec
in the number
qui
of
sont
cases in
très élevés
Quebec, which is a very
et en
high
Ontario,
number,
qui est une province
and
plus
Ontario,
populeuse
which
et où
has
le
a
nombre
higher
de cas est
population,
pourtant moins élevé
but
qu'au
where
Québec?
the number of cases is lower than in Quebec?
Dr. Yu?
Oh, OK,
Dr.
c'est pour
New?
moi.
Oh,
OK,
okay, it's
merci
for
pour la
me.
question.
Thank you for
Je
the
pense que
question.
M. Duclos va commencer. Non.
I thought Mr.
Ce
Duclos
qu'on voit
wanted to
actuellement
start.
à travers le
So what
pays,
we're
c'est
seeing
qu'on
currently
a la
across the country
transmission communautaire partout.
is that
Et
we
aussi,
have community
on voit
spread
aussi avec les
everywhere.
provinces et territoires, et si on parle du Québec aussi, l'Ontario,
In provinces,
qu'ils sont
territories,
près de la limite
including in
pour la
Quebec
capacité pour
and
vraiment
Ontario,
dépister. Donc, on sait que les nombres de
regions are
cas comme
reaching their
signalés
testing limit. So
officiellement,
we know that the number of officially
c'est
reported
sûrement, presque
cases
sûrement une sous-estimée de
is
la vraie
certainly
situation.
or
Donc, je
nearly
pense que
certainly an
oui, on continue
underestimation
au
of the
fur et à
actual
mesure pour
situation.
l'instant pour ramasser les données probantes, les cas signalés de
So we will
Québec et de
continue to
l'Ontario,
gather
mais je pense
data
qu'en fin
on
de compte,
case numbers in
c'est
Quebec and
partout dans les
Ontario,
deux
but we
provinces et
believe
c'est pas
that
vraiment une question de
the
comparer
virus
les
is
chiffres
everywhere
exacts
in
parce qu'on
both
sait
provinces and others,
c'est
but
une
we do not
sous-estimée
know
dans
the
les deux
exact
provinces
numbers.
aussi partout au
As I
Canada.
said, it's
Je pense que
underestimated in
ce
those
qui est
provinces and
important
everywhere in
maintenant,
Canada.
on commence une discussion avec les provinces et territoires.
Another thing I think is important now is that we're beginning
Qu'est-ce qui se passe
conversations with
dans les
provinces and
hôpitaux parce que
territories
c'est vraiment,
to
je pense, au fin de compte, plus important
ascertain
de regarder
what
c'est quoi
really is
l'impact sur
happening
le système
in
de soins de santé parce
hospitals,
qu'on
because
ne
our
sait pas
focus
encore
is
la question
on
est-ce que
healthcare
l'Omicron est
systems.
plus ou moins important pour les
example,
conséquences graves
we don't yet know
pour les personnes
how
contaminées, mais
serious
c'est une question,
consequences
un enjeu
are for contaminated
actuel. On
individuals
discute
with the
avec les
Omicron
provinces et
variant.
territoires.
So we are
On
in close
continue avec
contact with
le
provinces and
travail avec les
territories
provinces et territoires, mais je
discussing
pense
that.
que c'est plus un cas de vraiment viser sur le nombre de cas signalés dans la communauté,
We
mais
are
peut-être que plus une question
looking
importante
at
pour regarder
reported
qu'est-ce qui se passe
cases
dans les
in
hôpitaux. Merci.
communities, and we are also looking at the situations in hospitals.
We'll have
Thank you.
time for one more question, please, operator.
Yes, merci. Thank you. The next question will be from Stephanie Levitz from the Toronto Star. Please go ahead. Your line is open.
Thank you. My question is for Minister Freeland. It relates to the expansion of the benefits. As we've all alluded to over the course of this press conference, the testing system in this country has more or less collapsed. And in many places, people are being told that they need to stay home and isolate for 10 days, as does their entire household if anybody has symptoms, because there's no capacity for PCR testing. So this is effectively a lockdown. But the Canada Worker Benefit, of course, even with your expansion today, only applies in like this very specific capacity restrictive instance. So I'm wondering for all of these people who are being told, please isolate, please limit your contacts, they can't go to work, they can't get a paycheck. So what is the government going to do for them? Are you looking at all at expanding this benefit program any further?
Thanks for the question, Stephanie. And let me just remind you, as Carla pointed out in her remarks, that the caregiver and the sickness benefit remain in place. We extended the number of weeks you can claim for those benefits. Each of those benefits is at $500 a week. And that was also part of Bill C2. And I'll also point to the fact that we have passed 10 days of federal sick leave. So for people specifically who need to stay home to take care of someone who is sick or needs to self-isolate, or who themselves are sick or need to self-isolate, those benefits at $500 a week continue to be in place as they were in sort of the darkest early days of the pandemic. And then I would sort of more broadly say, we recognize that the restrictions that many provinces and territories have put in place are very significant. And that is really at the heart of today's announcement. We use the regulatory flexibility that we built in to C2 to give us the ability to provide wage subsidy, rent subsidy, and income support to people even absent a full formal lockdown. That's the heart of what we're saying today. But I will maybe pass it over to Carla to see if she wants to say anything more, perhaps about the sickness and caregiver benefits.
Oh, well, thank you, Christia. Yeah, just to emphasize, Stephanie, how important it is to have the caregiver and sickness benefits available to Canadian workers. So the caregiver benefit is available for 44 weeks now, and the sickness benefit for 8. If your child is not able to go to school for reasons related to COVID, you can take time off work and get this benefit at $500. If you have to self-isolate, if you're sent home from work to self-isolate, you have access to the sickness benefit. So the lockdown benefit is additional to these two kind of foundational pieces related to public health and sickness and COVID itself. The lockdown benefit is for people who have experienced job loss or reduced hours as a result of public health lockdown orders, which come in a variety of shapes and sizes, as we've seen, including reduced capacity orders, which we're adding to the list of orders today or that are being added that qualify people for the lockdown benefit. So it's in addition to these other ongoing benefits that we have.
Okay, thank you for that. And just as my follow-up, I guess it's back to you, Minister Freeland. You earlier used, you were talking about the distinction between Canada and the U.S., and you said that we have demonstrated national capacity to deal with this. But have we though? Because if we had the capacity to deal with this, then we wouldn't have PCR testing backlogs, meaning people have to isolate for days on end. We wouldn't be slashing business capacities to avoid overrunning our hospitals. And we wouldn't be worried about overrunning our hospitals if we had demonstrated national capacity. So I'm wondering, why it is you think we are somehow better prepared or have the capacity in place to weather this when many people don't feel like that's their lived reality right now?
Well, look, it's a really good question, Stephanie, and I do not want in any way to minimize how hard things are right now, nor to minimize the fact that we are in for some even tougher times ahead. And that is true. And that is really hard. And I was going to say it's frustrating, but that is probably too mild an adjective. These are some very difficult times, and there are almost certainly even more difficult times ahead. But I do think that it is also really, really important for Canadians to be reassured by the progress that we have made in the 21 months we've been fighting COVID, and to be reassured by the fact that we have a lot of tools and a lot of knowledge that we didn't have when this pandemic first hit. We have a very high national level of vaccination. That is a really good thing, and that is going to stand us in very good stead as we face Omicron. We have plentiful vaccines and boosters, and that is really important too. It means that as quickly as we are able to get the healthcare professionals out there to vaccinate us, we can add that additional level of protection. We have a lot of rapid tests in the country, and we've ordered a lot more. In the fall economic update, just last Tuesday, I announced an additional 180 million rapid tests that we are acquiring for 1.7 billion. And that was before, this really harsh reality of Omicron had hit. We announced that. We've talked about therapeutics in this press conference. And you know what? We have bought those too, as Jean-Yves has just reminded us. $2 billion to procure 1.5 million courses of treatment, with another 500,000 available if we want to buy them. So these are all really, really important healthcare tools that we have. We have the reality of a high level of vaccination. And I believe that we have public health authorities and provincial and territorial and a federal government that know how to work together and are able to support each other and support Canadians and Canadian communities in doing the right thing when it comes to fighting Omicron. And that is what the federal government is announcing today, that we are putting in further economic support measures to help us all get through these additional public health restrictions that are being put in place. That is an example of collaboration. And it's also an example of foresight and of thinking ahead. The fact that we had these tools already in our toolbox and are able to deploy them. So, look, I would never want to minimize the scale of the challenge we all face. It's a really big challenge. And Dr. Tam has quite rightly highlighted how hard it is, in particular for all of our healthcare workers who are working so hard, are no doubt so tired going into this. And I am grateful to them for the work they've done, and I'm grateful to them in advance. But even as we have our eyes wide open and are realistic about the challenge ahead, I do think it's really, really important also for us collectively to have the confidence and the strength that comes from knowing we can do this. We have the tools to do this. We have the individual character, and the collective resilience and intelligence and, community spirit, national spirit that it's going to take to get through this. And I think it is really important for the federal government to say to Canadians that that is the case, because it is.
And I would just very quickly add to that, we heard about panic earlier. This is not panic, this is prudence. Prudence from a health perspective, prudence from an economic perspective. It's also building, I think, public confidence, which has been very strong in Canada, confidence in our institutions and confidence in each other. Unlike, I think, in some other countries, we have shown how close to each other we can be, supporting each other in the context of our federation, using a portfolio of tools, which to be perhaps too not modest enough, is exceptional internationally speaking. So again, prudence, partnership, a portfolio approach to what we do, and I think this is what we need to continue to do as we move, I think, with more success than other countries through this next challenge.
Okay, that concludes today's press conference. Thank you, ministers. Thank you, doctors. Merry Christmas.